Welcome to Rooted in Wellness. I'm your host, Dr. Peete. And in this space where we amplify Black medical professions who are shaping the future of our healthcare in our community, today's episode is Rooted in Trust, the power of pharmacy in our community. Joining us today is Dr. Cedric Foster, a proud Memphian of here in Memphis, Tennessee, graduated back in 2016-ish or something like that?
2016, 2005 from Whitehaven High School, the Whitehaven High School.
See, here we go.
Black Haven.
Okay. So, what inspired you to go into healthcare, man? Like real talk.
So, basically, it went way back to like when I was young.
Mm-hmm.
The first thing I saw was just like my mother, she was a nurse. My grandmother was a nurse. My aunt was a nurse.
I vaguely remember you telling me this in school.
Yes, all the women in my family were just nurses.
Mm-hmm.
And also, you know, coming up when we came up, Bill Cosby, the Cosby Show.
Uh-huh.
And that was just like the first spark that like, I want to go into healthcare. I want to be a doctor.
Right.
I don't know anything about doctor, but this dude is funny. They got money. He got a big family. I want a big family.
Mm-hmm.
I want to have a beautiful wife. So it was like, let me go be a doctor. Let me get into healthcare. But then also the other part, which is the part that we always see in the Black community, is so many family members that suffer from different health conditions.
Okay.
And so when I look back, you know, my grandmother, she retired, but eventually grandfather, he had a stroke. He was bedridden probably about 15 years of the end of his life. Shortly after that, let's see, my grandmother, she had a stroke too. She wasn't bedridden. She was able to do things for herself, but it was a slow decline until she passed. That was last year, actually.
I'm sorry to hear that.
So she actually passed last year, and father, he had open heart surgery, but guess who was there to take care of all these people all along? Nurses.
Nurses,
but also
okay.
me being a pharmacist.
Okay.
But nurses all along. My mother and my aunt, both of them were basically caretakers for 20 years of their life.
Dang.
20 years.
So my question is, why you didn't go into nursing?
Because I didn't want to be a nurse.
Okay,
I didn't know anything about nursing outside of seeing everything they did, but I just knew I wanted to be a doctor.
Okay.
And I just knew from like a young age that I had that level of aptitude to go that far.
Mm-hmm.
And I think one thing about it was that I just knew I wanted to be a doctor. I wanted to go like all the way to the top. And that was one thing that my parents did from a young age, is just tell me like, go for the highest that you can go.
Okay.
So.
All right, so did you always know you wanted to be in this part of medicine? Or?
No.
Okay, all right.
No. No.
What made you specifically go into the pharmacy aspect?
You know what? And this may throw off the show, but I did not know I wanted to go into pharmacy. And I think I just ended up going that route because I think it seemed like the closest thing that matched to chemistry. Because when I got to UT Chat, I was a chemistry major.
You was.
So, you know, most people
I was trash.
are not, they either, like you said, most people are either biology or they chemistry. And I was the person that kind of was able to kind of do both. Cause I was
one of them special people, because I couldn't do it. I was good at Bio 1 and Bio 2, but Chem 1 and Chem 2, but I was in there struggling.
But you got to have like a math-minded, like,
for
brain.
Chem, for Chem.
And I was a person that loved math all the way through school. Okay. I even went through Calculus 1, Calculus 2, linear algebra, all that stuff.
Yeah, I ain't gonna lie. Looking in the camera right now, I didn't make it that far, but I did do bio. But I made it in biochem. I did good in biochem. I made it. I wouldn't be a doctor now. At what point did you was like, okay, this path of pharmacy, this is just the way it's gonna be? Was it just basically because of the math, or was it just like you got, as further you got into it, you became more interested?
I think the further I got into it, I wanted to stay in that route because in my mind at that time, I didn't necessarily want to go to medical school because I didn't want to do like the whole residency thing. If I could have went back though, I would tell the truth, I probably would have though.
But that would have been like what? That was what? So you did 4 years at Chet.
No, 5.
Don't feel
5.
bad. Don't
No.
feel bad. I did 6. I did 6. Don't
It's
feel
just
bad.
being real.
So you did 5 there, 4 medical school, then residency. That's what, another 3.
It'll probably be 3 or 4.
It'll be
I
another
think.
3 to 4.
Most time.
So
Yeah, something like that. Or 2 to 3.
So the average you would have came out by being about what, 33, 30, 34?
Yeah, something like that.
Okay.
But you know that wage is a lot higher.
Okay.
But
Okay. So just kind of tell me about you at in pharmacy school. What did it mean to you as a student here from Memphis to actually go to UT Health Science?
man, I think it was like just super duper important for me to be able to be at UT, just because all my family was still here. I didn't want to go. Like, I went off to school for chat, but I did not want to go off of pharmacy school, and especially with your parents getting older and people getting older. You just want to be back home, but also you just want to be somewhere where you're comfortable. And so, like, when I came back, it was just big. And then as well, you know, at UT, you don't have a large amount of black students. So I think it's starting to grow a little bit more. But all that being said, I mean, it was like probably about 10 guys. I can't remember exactly, but it's probably about 10 black guys. And pharmacy is probably more of a female-dominated field.
It is.
So all that being said, I had to go to 2 summer programs just to get into pharmacy school.
Hold up.
Yeah, 2 summer programs to get into UT. So
Specifically UT?
Yeah.
Or just in general?
No, in UT, because I got accepted at East Tennessee State.
Right.
But I didn't want to go to East Tennessee State all the way on the other side.
On the other side of Tennessee.
Where I would have been the only black guy there.
I believe it.
It was funny because when I went for my interview, somebody had called me Curtis. And I was like, Curtis must be the only black dude here in this part of Tennessee. So, you know, at this pharmacy school, must be the only black guy.
Okay.
So all that being said, I did the Tennessee Institute for Pre-Professionals program. So I did the test prep for the first year, first summer. And then the second year that I did, it was like kind of a practice pharmacy school summer program.
Okay.
And I only got into that because they gave me conditional acceptance into the school. So if I didn't do good during that program,
That would deny you.
That would deny me.
Okay. All right.
One quick thing just to add to like how serious it was. You know, I had to take prereqs at U of M.
Right.
And literally, I'm trying to get A's in all these prereqs to make sure.
I remember that.
And I end up sending my my prereqs, my grades over to Dean Oath. That was like one of the deans. And that was what got me basically conditional acceptance. Because I was in a preliminary pool. It's like, basically like you had a great interview, but we're not really letting you in yet. So you in the pool. And when I sent those grades, that's when they was like, you conditionally accepted.
Hey.
So, hard work.
All you needed was an inch.
Yeah.
You just needed an inch. You got in.
Yeah. Yeah.
Okay, so we're going to get to our next segment too. All right. This is basically just saying, like, a lot of people think that pharmacists just fill pills. That's pretty much. I'm just going to be real. Because remember in school, what was I? I was with you.
Right.
I was supposed to be a pharmacist too.
Yeah.
But then I end up switching over.
Yeah.
But what did I tell you when I switched? I said, my homie want to sit here and fill pills and everything for the next one. And then you just looked at me and you said, but you got it though. And I said, no, I don't want to do this. That's when I went down the other route. But hey, so just kind of break it down for us. Like, what exactly do pharmacists do?
So your pharmacist is going to basically be, so you have your medical doctor who is going to know everything about the medications, the disease states, and everything. But then you gotta have your pharmacist who is specifically the medication expert. So they are gonna know everything in detail from the route of administration, so how you take the medication. They're gonna know all the side effects. They're gonna know what medications interact with certain foods, other medications. They're just gonna know all those things, and they're gonna be the one that is going to basically get the prescription from the doctor and be able to tell the doctor, hey, this doesn't look right for this patient. That you've got them taking it too much, or maybe this is just wrong. Something is wrong about the prescription. They're gonna check it. Your technician is gonna fill the medication, and then the pharmacist is gonna make sure the medication is correct. And on the last end, they're gonna counsel you. So every pharmacist should be counseling you on the medication, telling you, how to take the medication, what it's for, and what things to look for, if you need to, contact your doctor or something like that.
So the counseling part.
Right.
This is me specifically, personally for me.
Right.
I'm gonna be real with you. I ain't been counseled by a damn pharmacist. I done never had. I'm gonna be real with you, because them folks at Walgreens, the folks at Walmart, the folks at Kroger. I have never been counseled one time when it came to them folks. Just gave me that money. And I gave them my money, and they just said here, and they walked out. I ain't never been counseled on anything. So just kind of give me like a short aspect of how would you counsel somebody.
Okay, so let's see, easy medication, antibiotic. So let's say you get some amoxicillin.
Right.
Okay, amoxicillin 500. And your direction say, I'll say, hey Fred, so today I'll take you to the side. I've got amoxicillin 500. They want you to take it 3 times a day. So you have 30 pills. It'll be 10 days.
Right.
Things that you want to watch out for is you want to make sure you eat something when you take the medication, because it may make your stomach sour or something like that. As well, if you notice that you develop any itching, or if you start having shortness of breath, throat feel like it's closing up, you may want to stop taking it, and you may want to seek medical attention immediately, because it may be serious allergic reaction. And so then I would ask them, do you have any questions? Do you understand what we talked about today?
Man, I ain't never got that before.
Well, it was a certain song that I remember in Memphis from a certain group, Break the Law. By law, in Tennessee, you are supposed to be counseled on every new medication. And so that's just one of the things that, unfortunately, working in the field, I've seen so many people that don't have that integrity to make sure
actually do it like they're supposed to.
They're supposed to do it. And that's why a lot of our people struggle in general, because
it's like
people in general, but especially our people.
Well, yeah, because I'm sitting there thinking as in the aspect of if a person has a chronic disease or something like that. Let's say a person has hypertension, or a person has diabetes or something like that, gout, anything like that.
Right.
I'm gonna be real with you. They just taking the pills.
Right.
They don't know anything about the pills. They don't know what the pills. They just know that the pills gonna help me with this symptom, and that's it. They don't know exactly what it's doing. They just know I can keep living.
And that's one of the biggest things that I see with me being at Christ Community now. That is one of the biggest things that I see is our people are not taking their medication as prescribed. And you'll have a person that'll have enough medication for the whole year,
right? But
they may have only picked up 1 or 2 refills out of the year. They're stretching medication, and you're looking up, hey, this was supposed to be out in 3 months from then, and it's like 5 months later.
Okay.
And then the big thing, only picking up during the holiday or after the holiday. So we like to pick up our medication after the holiday is over.
So is it a misunderstanding of the medication that it is, or is it like
It's a little bit of both.
What is it?
It's
what do you feel like it is the years you've been doing it? I'm just saying, because the only reason why I'm saying it, because I've seen it. I have seen it. They only get it after and then the craziest thing, and actually that is the highest time when folks go into the hospital.
Right. Because it's like, we want to have our fun. We want to have our cake and our cookies and our Circle B, sausages. But we don't want to take that medication, because we know what that medication means. That medication means that, hey, we have a disease state where we actually have to keep up with what we eat, when we sleep, and how we take care of ourselves. And so instead of, we want to take a day off from work, we want to take a day off from just everything, holiday. And so let's pick it up after.
Okay.
Yeah.
That's the thing right
But
there.
we do have a group of people that just really don't understand, it's just educational level wise. They don't understand the importance of taking it every day and how it works in the body. You have to take it every day to get the benefit from it. And then as well, we just stubborn. We feel like, okay, I'm eating better. I'm starting to move around more. I'm starting to do different things. I'm feeling better. Maybe I can
get off of it.
But you got to let the doctor tell you that, you got to at least take it because, you don't really know if you have hypertension most times because
most people don't.
It's silent.
Yeah.
So you could be feeling just fine. And we got a lot of people walking around with, 180 over 100 just fine.
Yeah, you're right. So give me something what would the public be surprised about? Like with pharmacy, just something that they could learn, surprising them about pharmacy.
Something that they would be surprised about with pharmacy. I think that we know most pharmacists know more about the medication than the doctors do, and
that is I actually believe that, but I don't think everybody realizes that y'all are actually the teachers and the doctors is just the folks that just prescribe. They don't really know everything about it.
Right. They know. Now, this is not to take away from any doctors listening or anything. They know plenty about the medications, but how we have to learn the medications in detail and the names and just everything. That's just like the first year of pharmacy school is just learning all the medications for every different disease state and then learning the side effects. And that's what we do the whole first year. And then everything else is just building on top of that. So it's like we're the most accessible, and that's the other thing. We're the most accessible healthcare provider in that system. You can't just go to the nurse. You have to leave a message or contact. Right. You can literally most times come up to the pharmacy and speak to the actual pharmacist.
Okay. All right. That's actually some good info right there, because a lot of people. I can say personally with family members, I have seen them personally try to call the office of a doctor, and the doctor be like, "Oh, well, I'm gonna call them back," and they ain't called them back in a month of Sunday, and they'll call them probably the following week, but then the following week it's too late now.
Yeah, it's just random, but I always wonder when people call their doctors, do the doctors actually call back? I feel like most times it's the nurse. I don't think the doctor ever.
I've never seen it.
Yeah.
I've never seen it. If anything, I've seen more nurse practitioners do the follow-up calls than the actual MD.
Right.
And that's just me.
But I'm right here in your face, down the street.
You down the street.
I might live around the corner.
You might be living around the corner.
But,
you're right.
Hey, what do I know?
Hey, a lot. All right, so we're gonna get to the next segment here. All right, so you have worked in retail pharmacy. I know because I remember you worked at Walgreens and everything.
Walgreens, Walmart,
yeah,
Sam's Club.
Exactly.
Yeah.
So underserving the African American community in Memphis. What patterns have you noticed?
What patterns have I noticed? Whew. Man, I think it's just a lack of just caring about themselves, and I understand that a lot of that comes from just being in the environments they're in. It's like so many different stressors coming at you at one time that you forget that, hey, if I'm not taking care of my own health, like I'm not making sure that I have my doctor's appointment so that I can make sure that I get my refill. I'm not picking up my medications on time. Like if I don't do that, then if I have to go to the doctor or the hospital, guess what? I'm at a commission for another week or 2 weeks. So it's just like, I think the thing is just the lack of self-care. And that's a big thing. And just the inconsistency.
So would you put that in like what cost be a factor in there too as well?
What?
Just with medications in general.
Yeah.
Cause me personally, with patients that I've seen of mine, it's usually the diabetics,
Mm-hmm.
the hypertension folks
Mm-hmm.
that usually they be like, I can't afford it. I can't afford this week. So they'll go to vitamin shop down the street and be trying to find out this other stuff.
It's a combination of both, because there are a lot of people in the underserved communities that actually have, TennCare or Medicare and things, Medicaid, all those different things.
Mm-hmm.
And sometimes it's just they're not utilizing all of the benefits that they have. Even, at where I work at, we have people that don't even know that their insurance companies will provide them rides to their doctor's appointments or provide them rides to the pharmacy. But yeah, I think we don't have enough people maybe that are also able to take the time to teach them that.
Yeah.
Because there's no reason why a patient should know that, hey, I need to come in every 3 to 4 months. Nobody's ever told you that, and you'll ask them, nobody ever told you that? They said, no, nobody's ever told me that. But I understand how overworked people are. And so people are sometimes missing those consultation points. But we just need more education in our communities, like more hands-on. We really got to walk them hand in hand down that line.
Yes, you do.
Yeah,
you do. All right, so how much of effective healthcare is about trust to you?
I think a lot of it is just 100%.
100%,
because you're coming in as a person that nobody knows. Like, I don't know you. I've never seen you a day in my life.
Mm-hmm.
And I'm telling you, this is what you should be doing with your health. And it's like, I have to trust you with that.
Right.
That you're telling me the right thing. You're telling me to put something in my body that I've never taken before.
Anything about.
That you don't know. You don't know how I feel. You don't know what my day-to-day is. But you telling me to take this and I'm going to be better? I don't believe you.
It's you got to find out the hard way.
Right. You got to find out the hard way. But part of what I do as a healthcare professional, I feel like you do it too. Being able to present myself in the best way, shape, and form to somebody that looks like me. I think about that person like it's my grandmother. I think about that person like it's my mother, like it's my little brother, my little sister, my son, daughter, because you see people that look like you. Mm-hmm. And a lot of these people, I've seen them, when I used to work at Elvis Presley Reigns. I used to see these people. I'm like, I know these people. Mm-hmm. I ever see them at church. I ever know the kids. So that's the only thing.
Uncle, everybody.
But as well, I also present myself like I'm healthy.
Right.
And so, my journey.
Yeah.
I make sure that if I'm going to be telling you, hey, you need to be drinking water, you need to be eating the right thing.
You got to look the part.
You got to look the part, because how else? How else would they trust you?
That's true. So you said this. You said that it's not always about just discussing the medication. Sometimes it's about making patients feel seen and cared for. Like,
connection.
Why does it matter that much? Because of, like you said, the connection.
Like, it's like building those connections. Like, I've walked in, and I love being at a place like Christ Community where it's like faith-based, because I walked in before literally coming in, and I wasn't even working in the clinic that day, but I had a patient that was like asking a question about, I think it was like a medication, but then they just kind of started spilling more and more out, and their frustration with things, how they felt like they were being treated and different things like that. And they just were so thankful that I took the time. It was like maybe like 15 minutes. Like, sometimes you walk in the door, you don't even get a chance to get to where you need to go.
You don't.
And somebody's pouring their heart out.
They ready to go.
And they ready to go. Whether it's they ready to get their medication, they're ready to get something, but then too to have somebody actually pour out to you and you just able to receive that. Because what I find is people build that connection just by you listening. And when you take that time, whether it's an extra minute, 5 minutes, 10 minutes, now you do have to know how to curve that.
Man, you gotta have the curve.
But having those moments and having more of those moments than not having them, you'll find that you'll get the benefit, and then the patient also gets the benefit. And I think that's what we really got into it for. Versus, no, you shouldn't just be in it for the money. Like, you should really be looking at the quality of healthcare that you're providing, especially for the people that you're providing it for. We want everybody to do well, but with us being in the Black community, these are literally our family members. They're our indirect family members.
Exactly. It should be the
And
reason
in
why
Memphis,
you got in.
they might be a family member because it's smaller than you know.
Yeah, man. I found out. I ain't gonna lie. Shit, I found out I had 3 cousins there. Didn't even know it.
Man.
I had no idea. Everybody was like, "Say, what part of Memphis you from?" I said, "I'm from East Memphis." He said, "Man, but you South Memphis." Man, come to find out, my great aunt had died. That was my doggone granddaddy's sister.
Wow.
Didn't even know that.
That's crazy.
It's the same thing I see.
It's like that though.
But everybody in Memphis is like, what they say in Memphis? Everybody's like, what, 4 degrees?
6 degrees.
It's
probably 1 degree or something.
Something like that. It might be.
Because everybody know everybody.
Everybody know everybody. All right, so we gonna get to our next segment over here. So we want to educate our audience real quick.
Mm-hmm.
So if someone is prescribed a new medication,
Okay.
what are the top 3 questions they should ask?
Top 3 things they should ask. What is this for?
Okay.
What is this medication for? You really should ask, what do I do if I miss this medication?
Okay.
What do I do if I miss it? Because realistically, we may forget. I may have something that I have to take and I forget to take it. So what do I do if I miss it?
Okay.
And most of all, what are the side effects?
Okay.
Because I need to know what I need to do if I need to stop it. I need to know, okay, if it is a side effect, but it's something that's going to disappear after a while, okay, do I just keep taking it through that? Or when do I need to go to the hospital?
Okay. So does every medication need some type of food aspect with it?
No. That's the only thing. Food is an optional thing. With certain medications that work within the system of the stomach, those medications may need specifically need food beforehand.
So this is just me personally. Why does taking food with the medication necessarily? Because I think I already know the answer to it, but I want everybody else to hear. Right. Why do I need to take the medication with food?
Well, it's basically gonna help it from, if certain medications, when they hit the stomach, they irritate the stomach.
Right. So
when you take the food, it just stops it from hitting the stomach directly.
Okay.
So that's the only thing. Certain medications just work better with food.
Okay. All right. So there's a word. All right. So what about timing?
Timing is not important most of the time unless you have certain medications like cholesterol medication, like the statins. They usually like you to take those at nighttime. It just helps with the release of certain medications when you take them at certain times, but as well, just the consistency. If taking certain medications just every day at a certain time, it just becomes a cycle.
Okay, so setting a timer on
right.
the phone or something like that, just to take it. Okay.
But as well, certain medications you do need to actually take before you eat any food, because that's going to help the absorption of the medication. Okay.
So what are mistakes that patients commonly do with medications?
Not reading the directions.
I can see that.
Not reading the directions, because you'll have a person that has a medication that they were taking once every day, and they'll get a new prescription that says take it twice a day, so it's like a dose increase. So instead of reading the directions, they're just I'm just taking it like how I was taking it.
Right.
So now they taking the medication once a day, not getting, whatever the benefit was, because they're just taking it once a day.
So what if they gotta like take multiple medications?
If they have to take multiple medications.
Yeah, so we talking about like,
yeah. So
basically taking a cocktail pretty much.
No, you can take multiple medications all at once, unless like there's an interaction and it may be something you may need to stagger it and take it like later in the day. But the main thing is just like when you do have patients that take multiple medications, sometimes they don't read the directions with those. So they could possibly mix one up and say, hey, I'm taking this one twice a day, and maybe it was just once a day. Or maybe they thought, hey, I thought I took that medication, but you're taking 6 medications, so
you just off.
You just all the way off. So that's why we recommend pill boxes for most patients. That's usually good. You have a lot of phone apps now that people, can use, but when you have those pill boxes, it's just easy to pop it open. Monday, take this pill.
Okay.
You just get used to taking them, but that's probably one of the biggest things.
Okay. So then we're gonna get to our last segment right here. So,
okay.
We pretty much have spoken about, the blueprint of excellence that came from the both of us and everything. What does being a black pharmacist mean to you here?
Man, being a black pharmacist here, man, it just means being able to help set a new path for like our people, because you don't see a lot of us in healthcare. Now you're seeing more. Let me correct that. You do see a lot of us in healthcare because this is a predominantly black city, so you are going to see more black providers. But I think the thing is, everybody doesn't want to go that path. Right. And so I think by people being able to see people like me and you, just people that they associate with, they understand that it's something that's obtainable. I think that's the biggest thing, is just understanding that, hey, I came from the same community, the same schools, went through the same pathways that you went through, right. And you can get there too if you believe you can. And I think a lot of it for our community is just seeing people that can do it, that look just like them.
You're right. So pretty much me and you both said reputation, like just representation of just in general is a big thing. So if let's just say like a black student was watching this today, what would you tell them? That was thinking about trying or wanting to get into pharmacy.
A black student from the beginning?
Yes, from the beginning.
I got words for you.
For the beginning.
First of all, you need to be striving for A's from the beginning.
Right up top.
Like, if you were an A student, continue to be an A student. Do not fall off. Do not let your friends pull you down. Do not let anybody around you pull you down to be lower than an A student.
I think you shots fired on that.
And when you get that first B, you need to cry and you need to pick yourself up and try to go back and get an A, because it's a hard path when you're trying to come from the bottom.
It is.
And me and Fred know, undergrad had a lot of failed classes.
Retaking them.
And retaking them. And it's just hard to come back up. So just don't even put yourself down that path. But to continue, when you get into high school, make sure you continue, just pushing yourself in those classes that are harder. Put yourself in honors. Try to take AP classes, because when you get to college, you'll already have a good foundation of how you need to study.
That's facts.
Also, a black student, do not think anybody's going to give you anything. You are going to be by yourself in most of these classes. And I can tell you, I've had some great teachers, and some of the best teachers that I had were the ones that failed me, because they put me on track to know, hey, you come to class, maybe your performance is not as good because you're late. You need to be sitting in the front of class. You need to come to class and you need to take it serious. And just know that nobody cares. Nobody cares if you don't pass the class. You got to care.
That's true.
You got to seek every resource that's available. And then too, once you actually get to whatever school you're trying to go to, whatever field. Just continue to keep going and elevating and putting yourself around people that are above you, putting yourself in a group of people that are seeking as high as they can go, because if you don't see it, you don't know you can achieve it. You don't know how high you can go.
That's true.
And I think so many times we get in a space of working in a field or feeling like we're doing great. We get comfortable with, I guess we get comfortable not being in the struggle. You need to always be pushing yourself. Every time. I went back and got my MBA last year. I'm working on certs. So I'm still trying to like climb.
You better than me, bro.
I'm just saying, but you gotta always be pushing.
Healed. I'm not healed from that doctorate yet. I'm not healed. I'm sorry. I'm not healed yet. Don't get me wrong, y'all. I love my doctorate. That doctorate, excuse my French, I bust my ass for that doctor. He did too. I saw
it. And I'm still busting my ass because you got to. Because nobody's going to save you. You got to do the work.
You right.
You got to be disciplined. And just continue to keep your health up.
That's it.
Because the only way you're going to be able to get to a certain level is with good health.
That's it. That's fair.
And that's it.
All right, well, I appreciate you, dog.
Man, I appreciate you letting me come through, man.
The pharmacist is often the final voice you hear before beginning a treatment plan. That voice matters. Trust matters, education matters, representation matters. When we understand our medications, we ask questions. We build relationships with our healthcare providers. We protect our health. Dr. Foster, I want to thank you for your commitment to our community and for reminding us that care begins with trust.